this is Tyler from Southern California EMS Training Institute. Today we're going to talk about EKGs and how to set up two different types of EKGs. That's 4 leads and 12 leads. So we're going to go over exactly how to do that right now. First off, an EKG, this is a portable cardiac monitor. So it is able to actually monitor somebody's electrical rhythm of their heart. It is an ALS skill or a paramedic skill in their scope of practice to be able to go ahead and use one of these. But as an EMT, we assist the paramedic in a lot of different ways, so we need to know how to set this up appropriately so that the paramedic can go ahead and continue other tasks and we can get the EKG set up. First off, it's either EKG or ECG, stands for electrocardiogram. You can say either one. A couple things that we need to know here is we have our monitor, but we also have our leads. So as I come over here, I'm going to just unzip my leads. I'll show you guys, I got a couple different types of leads here. Mine are all nice and tangled up. I should have, first off, our first 4 leads, and this is known as our 4 lead. So our 4 lead actually is going to come in a couple different colors, and I'm going to go over exactly how to set these up as we talk about our 4 leads a little bit more. But so I have got my leads, I got my cardiac monitor, I thankfully have a patient, and then I also need some sort of EKG stickers or EKG patches that are actually going to help what reads the electrical rhythm off of the patient's skin. So we have all of our equipment here. I can go ahead and open up some of my patches. Something I like to do personally is I like to get all of my stickers in place before I attach them to my patient. Just easier that way than putting the sticker on and trying to attach the lead to the patient's skin. Doesn't work very well. So first off, we have our first 4 leads. Our first 4 leads are known as our limb leads. Right? So again, we have RA, LA, RL, and LL. Right? So that stands for right arm, right leg, and left leg. Really scientific here. Now we can see here, my patient doesn't have any arms and legs, but we can also actually put this on the patient's chest and abdomen. It does help to get a better picture if it is on the patient's arms and legs, but you'll see the hospital prefers to have it on their chest and abdomen, whereas a lot of people in the pre-hospital care setting like to have it on the arms and legs. So one thing we need to know about this is it's really important that we don't put this over any bony tissue. If I put this right where a patient might have a bone, it picks up a lot of noise and artifact in my EKG. So it's good to get it on nice fleshy tissue because electricity really transmits well through the watery tissue. So find a nice fatty, muscly part of the tissue, and that's where you want to stick your pads. So first off, we're going to go ahead and put on our limb leads. So I'm going to start off with my left arm, which is my black lead. So one thing that we always do with my left arm or my black lead, it can go right up here. Make sure you don't go on the clavicle or the shoulder, kind of just like in the mushy part right in between those two. The left arm is going to go on the black lead is going to go on my left arm, and then this one, because my patient doesn't have legs, is going to go down here, kind of in his abdomen, on the mushy part of his abdomen. And so I got my left leg. Now, a good way to remember this, right, is because we do have the colors, and some leads don't have LA and LL there for you, that we always say smoke over fire, right? So the black is on the top of the left side, where the red or the fire would be on the bottom, right? So smoke over fire is a good way to remember, right, where that EKG lead goes. And then we could also say white on right, right? So we take that white lead, and we're going to go ahead and stick it right here on the opposite of where my black lead is. So I got smoke over fire and white on right, right? So that white goes up towards my patient's right shoulder or on their right arm. Now I still got one more lead, right? Because we did say it is called 4 lead. All right, and this is actually my right leg. And so we could also say clouds over grass. You'll hear that. Some people like to say that. So smoke over fire, clouds over grass is a good way to remember, right, where these patches go. It is important that they go in the right areas, because if they do not go in the right area, it does not work, right? We will not read that rhythm appropriately. So now that I got these leads on, I can go ahead and turn on my cardiac monitor. I'll do that for you in just a minute so you can go ahead and see that. But that is my 4 lead. So I can monitor a patient's electrical rhythm very easily by just having these 4 patches on them. It will give me their heart rate in real time, and it will also actually give me their electrical rhythm. So now, one other thing that we like to do is we like to do what we call a 12 lead. Now, a 12 lead is something we do commonly if we are suspecting our patient's having some sort of myocardial injury. Again, so that's some sort of injury to the heart muscle tissue. So Our 12 lead actually comes with 6 additional leads. All right, so we have 10 altogether. All right, but we call it our 12 lead because we actually get 12 different pictures of our heart here. And so we're going to go ahead, we're going to put these on. They need to be put on in the appropriate spots. Otherwise, we are not going to get a good reading for our patient. So I'm going to go ahead and get the rest of my patches hooked up. Again, like I said, it's always best to get your patches on first, as you can go ahead and do this. Now, an important thing when we're hooking up a 12 lead is to know the appropriate terminology. Now, some of the terminology that we use is we use things like the mid-axillary line. We also use things like the mid-clavicular line. And we'll also use what we call intercostal spaces. Intercostal spaces is a fancy word for saying in between the ribs. And we do need to be able to put them on the correct spaces in between the ribs. So as we're dealing with this, we're going to go ahead and we're going to make sure that these go in the right spots. We always start off, you guys can't probably see it very well, but we have what we call our V leads, or also called our precordial leads. All right, most commonly called our chest leads or V leads. We can see here that we have V1, V2, V3, V4, V5, and V6, and they all need to go in the specific area, and it's always the same every time for every patient. So now that I got my V leads, I always start with V1, and then I go to V6 pretty much. Now, when we're setting up EKG leads on a patient, we actually put our V1 lead in what we call the 4th intercostal space, all right, a line right between the middle of his clavicle. It almost goes through his nipple. It's maybe just a little bit on his side of his nipple, and it's the 4th intercostal space. So we need to be able to count our intercostal spaces. You can do this on yourself at home right now and follow along. But the first thing we do is we find the clavicle, right? The clavicle kind of covers the first rib, so we can't really feel the first rib. But we go down from the clavicle and we feel our second rib, right? From our second rib, we go down. From there, we feel our third rib. And from our third rib, we go down and we feel our 4th rib. All right, and then we go just below our 4th rib, and that is our 4th intercostal space. It's in between ribs 4 and 5, and that is our intercostal space right here. I'm going to go ahead and right where my finger's at is I'm going to put this right just the middle of that patch, right where I just have my finger. Now it's really easy because V2 actually goes on the exact opposite side, mid-clavicular, and 4th intercostal, but on the left side of my patient's chest. And so I'm just going to mirror it right here for my patient. Now, if you're like me, I do something kind of similar, or something silly. Is I go to V4 instead of V3 next. But my V4 will be my mid-clavicular one, and the V4 one is going to go pretty much straight below the nipple line and at my 5th intercostal. So again, you got to go down and feel your intercostals. Pretty much it's almost just below the nipple. I typically do just below that left breast a little bit. And that V4 is going to go right about this area. You're like, okay, Tyler, well, what about V3, right? Because we kind of skipped over V3. Well, V3 just kind of comes right in between my V2 and my V4. All right, and it should almost make like a straight line. You see, I kind of put it right on top of the patient's nipple. That's going to hurt when it comes off. But again, we should be kind of covering that area. You can put it a little bit off center, but I kind of like to make that straight line down through. Now, the next thing I do is I'm going to select my V6 lead. My V6 lead is actually on the same level as my V4, but it's mid-axillary. So if I were to draw a straight line underneath my patient's armpit, right, it should be even with my V4 lead, but mid-axillary. So if you were to cut that patient into front and back calves, that's where we have it. And then lastly, we have our V5, and again, our V5 is actually on the same level as V4 and V6, and it just goes directly in between the two. And so now we have our chest leads on. Once I have my chest leads on, I need to go ahead and make sure I plug it into my EKG monitor. All right, so I'm going to attach them to my other leads, and now I can come on over and I can, turn on my EKG monitor. A couple of recommendations for you is, number one, see if we can't get the wires to sit somewhere nice and still. One thing we can do is put a blanket over our patient. If our patient's shivering, it kind of makes some noise and artifact in our when we try to read this patient's cardiac rhythm. But the blanket also kind of helps push the wires down, kind of gives us a nice clean reading. Ask the patient to sit still, not move, because all those things can kind of disrupt our ability to read this patient's cardiac rhythm. So Again, just wanted to go over you guys the correct positioning. Remember our 4 leads, we always start with smoke over fire. Your left, your smoke, your left arm goes up here. Can go on the left arm itself, but make sure it's on some nice meaty, muscly tissue. Left leg, our fire comes down here onto our patient's left lower quadrant. Our right arm is that white lead, white on right, opposite of our left arm. And then clouds over grass, the green one comes down here into our patient's right lower quadrant. Our V leads are our chest leads. Remember V1, V2, just about 1 inch to 2 inches on either side of the sternum in our 4th intercostal space. The V1 is always on the right side of the sternum. The V2 is always on the left side of the sternum. V4 is about mid-clavicular at the 5th intercostal space. And then again, V3 can be put directly between V2 and V4. And then we come over and put V6. V6 is in our 5th intercostal space, right under our patient's armpit in our mid-axillary line. And then again, our V5 can just come directly in between our V4 and V6 leads.